Hi everyone! So I'm very excited about this video that I'm doing today. It is about wound care and I really enjoy wounds. I'm kind of weird like that. And I'm hoping to be a wound, ostomy, and continence nurse. And I also had a pretty bad wound. You might have seen my scar in some of my videos. I have that wound from when I had ostomy surgery because they had to cut me open fairly large, unfortunately, to clean me out. I had peritonitis, so that's why I wound up with such a large scar. And my scar had something called dehiscence. I hope I'm right about this. We've learned about it in nursing school. So dehiscence is when the wound kind of opens up and it has to heal from the inside out. And then there's evisceration, and that's when it completely opens and you start having organs pop out. That's an emergency. I didn't have that, thank goodness. I just had a very slow sort of I don't know, just peeling open of my wound. And there were lots of little strings, lots of tissue strings, that eventually they just said, let's just cut it with a pair of scissors because I had a lot of tunneling. And towards my belly button, I had a lot of tunneling, so when we would do the dressings, we would have to use a little Q-tip like this and push gauze up into it. Very painful. So there was lots of different things with my wound, but in this video I'm going to do a very simple wet to dry dressing, and that's because I can't, I'm only working with what I have now, and that's my scar. I do have what I call my canyon because it still has quite a bit of a divot. Wounds usually do fill in quite a bit. It was a lot deeper than it is now, but I'm only working with so much here, so I'm just going to do a very simple wet to dry dressing and tell you a little bit about it as I do it. So I hope you enjoy it. You'll get to see how a scar heals, how well it looks. Mine looked pretty terrible. I would share a picture with you, but I don't have one anymore. So you could see kind of what it looked like. It had a little bit of infection that showed up in the bottom. Like the very lower part of my scar is like white tissue. So when we did the dressing, we would do a wet to dry because the whole point of that is to have the wet gauze pushed up against all of the scar or the wound itself, all the open tissue, and then a dry piece of gauze over top. And just kind of a very light piece of gauze because the point is to have the wet piece dry inside, kind of connecting to all that gross tissue you want to get rid of. So when you go to change the wound dressing, the wet piece, the once wet piece, you'll pull out and it'll pull off all of that, and that's called debridement. So lots of terms today that you're going to learn, and I will say them again probably throughout the video. So anyway, my voice is dying on me. You can tell I'm like creaking. So I hope y'all enjoy the video.
Okay, so I'm just going to kind of fold my little ostomy bag over so we can actually see my scar. And you can see it's filled in quite a bit. It was a lot deeper before, but it's kind of shrunk in the length of it and the depth. So that's good. It's healed really well. So yeah, this is how it's supposed to heal together. And what happened was the dehiscence, which just means that the surgical site split open. So it had to heal from inside out. So you could see all the pink tissue inside, and towards the bottom of the scar there was actually some white tissue, which they told me was a sign of infection. So when we do this, wash your hands. This is what we do at home because there are a lot less germs at home than there are in the hospital. And I mentioned this in the end of the video. So completely different situations. Here we have Duoderm. And these are two different kinds. This one is a very giving sort of one, so you can see my fingerprints in it. So we're not going to use that one. I'm actually going to use the other one in my other hand. And this has got sort of a rubbery, very texturized surface to it. So this will be great for putting around the scar. You can actually keep it there for multiple dressing changes, and this is just so if your patient is really feeling a lot of pain during the dressing changes with the tape, you're not peeling tape off of them, you're peeling tape off of the Duoderm. So this is like, we're kind of like putting on a second layer of skin for them. So I'm just going to measure it out, and I'm going to over measure, give some extra room for the top and the bottom, because I'm not going to go too crazy with this. I'm not going to put a piece underneath and above. So I'm just going to cut about an inch wide piece. And this is going to be a piece for each side. So we'll wind up with 2. You can see it matched up with my scar here. I'm just going to cut another one and get it ready to go. So you can see the texture really, really well here. And let me peel off the backing and we'll stick it on. And you can see it's very sort of moldable to the skin. It's very thin, so the patient can move around, or you can move around if you're doing this for yourself. I'm just going to press it on nice and tight, not tight, what's the word? Press it on well. And here I'll put the other one on. So you can see I'm not putting it in the actual wound site. I'm putting it, giving myself at least a few millimeters on either side, just to make sure it's not getting into the scar, because that'll be painful when you peel it off. You don't need that. And there we go. We're ready to actually start the dressing, and I told you before we're not doing the bottoms. So here's a 2 by 2 inch gauze sponge, and it's a very thin sort of thing. It looks kind of stringy, and you'll see in a second. And I'm opening it this way because technically this is a sterile field. So if you open up the package flat, that is sterile in there. If you have sterile gloves on and all that, it'll stay sterile, but it's not going to, obviously. I just broke the sterility. I'm going to show you what the gauze looks like when you open it up, and this is what you're going to do when you have a wound. So you want to get it pretty thin, and I actually only needed 1 piece for mine, because I really don't have much of a wound. It's not a wound anymore, it's a scar. So you can see it's really thin. Okay, so here's our sterile field, and you can work on this. Might be a little bit difficult, but you'll see nurses in the hospital do this. Or you can work in a little box, which I'm going to bring out in just a second. It actually is a box that contains gauze. It comes in it, and it has a lid to it, but I took all that out just so we could use it. And I'm going to put the gauze in here. And then I'm going to take sodium chloride, 0.9% sodium chloride, normal saline, whatever you want to call it. And these are really nice little tubes. I have a whole box of them that's left over from my surgery. And you just twist the top off. And you are going to saturate all of the gauze. Now you don't want to soak it, but you don't want to leave it too dry. You want all of the gauze to be wet or damp. So I'm just going to put a few drops, and then I'm going to wring it out, just so it's got the perfect amount of the saline in it. And you can see I'm kind of mixing it around. You can do this at home if you want to do this. I think I would wear gloves. I don't think my dad did. And it was fine because, like I said before, the environment is completely different. So I just wrung it out a little bit. And I'm going to show you what it looks like. You can take it all apart. And this is what I'm going to do for mine. You kind of shape it to whatever your wound site looks like. So mine was long and thin. And this is a cotton-tipped, I want to call it a Q-tip, like a long Q-tip. And it's got a little ruler on it, but I didn't use that. So I'm going to open it, and you can see the end is at the top, which is convenient, so you're not touching the actual Q-tip part when you open it. And this I'm going to use to press down the gauze into the wound. So let's get that gauze going. There we go. And I can shape it with my hands before I put it in. The important part with this, though, is that we want the entire wound site, all of the pink fleshy tissue that you have, you want all of it to be touched by the gauze. But then You don't want the gauze, the wet gauze, touching any of the healthy skin outside. So we're going to try and avoid that as much as possible because that increases your risk for infection if it's touching the outside skin and then you're pulling it into the wound. And also, it'll make the healthy skin break down, and we don't need that because we already have this lovely wound to take care of. We don't need to increase our work here. So I'm pressing it in, and I want to touch every part of the fleshy tissue. So I'm making sure I do a good job. And before, like I said, I think I said this in the beginning, I had some tunneling at the top, so I had to kind of shape the gauze beforehand into a pointy end and stick it in with a Q-tip into this tunneling. It was really odd, but very, very cool to see. So that's all done, and now we're taking a larger piece of gauze, same kind. This is 4 by 4 inches. And again, when we open this is going to be another sterile field that you can work on. And I would recommend when doing this to prepare all this beforehand. Get everything open so you don't have to worry about it. In this video, I just wanted you to see all of the packaging and stuff so you kind of knew what you were working with. So here we go. You can see it's larger. And I definitely do not need all of this. I think on the package it said 12 ply. Don't need that. So what I'm going to do, and you can see I'm going to open it up so you can see how thin it is. And I'm going to wind up cutting this in half, this one piece. I'm going to cut it right down the middle. And mind you, wound care, to me, from what I've learned in nursing school, is an art. So it's not going to be the same thing every time. You're going to find what technique works better for you and, you know, what's the most simple way of doing something. So, all right, so I'm going to take this piece of gauze and fold it in half because I want the long thin. So I think at this point it's 4 ply, I want to say. I've lost count with the cutting and the folding. So, now that it's long and thin, I'm going to place it onto the scar, or the wound, in quotes. And this is a thin piece of gauze, enough to let airflow go through to help dry the wet gauze inside. And we want that wet gauze to dry and to connect and kind of stick to all the icky tissue we want to get rid of. So we don't want that outside dry gauze to be too thick. We want the airflow. And I love this tape. It's called, what is it called? Transorb or something. And Transpore. I was trying to read the inside. Really great tape. I love it. I think some people are allergic to it, however, but I, thank goodness, wasn't. And it rips just so easy. It's just perfect. It's got perforations in it, so it's just really great to use. And I'm just measuring it out and sticking the tape on the duoderm and on the gauze and not on my skin. So this is, when it comes off, it's going to help with the pain because I'm not going to be ripping any tape off of my skin. And we'll take another piece and we'll do the same thing on the other side. Okay, and I'm going to put one more piece down at the bottom. I'm not even going to bother with the top because of gravity. And from what I remember in the hospital with my wound, we would sometimes put a little extra piece of gauze at the bottom because I had a lot of drainage. So this would help to catch the drainage, but it was only at the bottom, so we were still getting airflow through. And there we go. We are all set with our wound. And I believe mine took about 6 months to get to the point that it's at now. It took a while, so... And we're going to take it off now. I'll show you that. Mind you, with all of this, this whole process of dressing, you want to pre-medicate. If you have pain medication, take it. Because it's going to be painful taking out the gauze. So I'm just gently ripping it off of the Duoderm. And you can see that I have the wet gauze still inside. Now, you might want to use a pair of tweezers to pull out this gauze, but I'm not going to. And I was shaking my finger there. I wanted to include this point. Do not saturate the wet gauze with any more saline. That's not going to help you. It's just going to make it so it's not sticking to the dead tissue, and you won't be pulling off. You won't be basically achieving what you wanted to achieve with a wet to dry. So on this piece of gauze here, you will see the tissue. And like I was saying before, you might want to use tweezers, but in my case, this isn't a real wound, so I just used my Q-tip or cotton swab, whatever you want to call it. I just used that again because it really was not sticking to anything. It's all scar tissue now. So I'm taking off the Duoderm, and this part was a little painful for me, so you can imagine a patient who it's kind of tender and raw there. It might be kind of painful, so.
Okay, so that was the video. That was me changing a dressing, doing a wet to dry. I hope it helped you, especially if you are currently doing this at home. Mind you, I think I will say it in the video because I'm filming this right after, but I haven't done the audio yet. If I didn't say it, I'm meaning to say it now. When you're at home, it's completely different than when you do it in the hospital because there's so many germs in the hospital that you just don't have at home. So when we would do it in the hospital, it'd be very sterile, gloves, oftentimes sterile technique used, but at home it wasn't like that at all. My dad did not use gloves or anything. Just wash your hands really well, and you're usually okay. So I really hope that you all enjoyed this video. I know I did. I was so proud of my little wound dressing that I went outside and I showed Zach. So I know I'm weird, but that's okay. If you have any requests for videos, please let me know. And did I say everything? I think I said everything. So I will see you all later. Bye!